A second coronavirus vaccine could be made available in the U.S. as early as this week. A panel of FDA advisors will meet Thursday to discuss Moderna's application for emergency use. The vaccine is expected to receive authorization by the FDA after the agency confirmed that the drug was more than 94% effective. Another vaccine couldn't come sooner as the country nears 17 million confirmed cases. Nearly 200,000 Americans tested positive on Tuesday alone. More than 3,000 died. We begin our coverage with David Begnaud in hard-hit California.
Tonight, protecting the nation's most vulnerable as nursing home patients and workers in West Virginia and Florida are getting their first dose of the vaccine.
What a great time for this to come, really to put an end, hopefully, to this virus.
Members of the military are also being immunized as Pfizer's vaccine rollout continues across the country. CBS News obtained exclusive access as more than 4,800 doses of the vaccine arrived at UC Davis Medical Center in Sacramento, California. As soon as they came off the truck, first stop is the pharmacy to start opening the box. The vials were immediately put into this ultra-cold freezer. They were then taken out in small batches, labeled, and thawed. Dr. Nate Cooperman was among the first to get the shot.
I now know that I will not die from this disease.
Tonight, there are new reports about a glitch that's affecting vials in California and Alabama, which arrived too cold to process thousands of potential doses that now need to be replaced. The first report of serious side effects involves a middle-aged healthcare worker in Juneau, Alaska, who had an allergic reaction within 10 minutes of getting the vaccine. The FDA issued a reminder today that people with severe allergies to vaccines should refrain from taking it at this time. Along with the hope that comes from a vaccine, there is so much despair. California reported nearly 54,000 new coronavirus cases in just one day. That is the highest ever for any state. California's hospitalizations and deaths are also at record levels. Hospital employees like Marcia Santini are now out sick, struggling with COVID.
This was like someone punched me in the gut and ripped my heart out.
There is a new study which shows a majority of kids with coronavirus got it from their families, not from their classmates. Dr. Anthony Fauci says he's hopeful that an overwhelming majority of Americans will take the vaccine when it becomes widely available this spring.
We will get a veil or an umbrella of herd immunity over the population.
And finally, after battling COVID-19 since November and giving birth while in the hospital, Natalie Herrera finally got to go home this week to hold her one-month-old baby boy, Felipe, for the very first time. We just arrived in Fresno, California, and here in the central part of the state, the largest hospital has run out of ICU beds. They don't have any left. In fact, they have more employees out sick or because they were exposed to the virus than they even have COVID patients in the hospital, and they've got a lot. That's why they put up all these tents outside, to treat additional patients. You know, before we go, Lana, there's a really interesting tweet from Dr. Tom Frieden, who used to run the CDC in Atlanta, and he says the mRNA inside the Pfizer vaccine is like an email that goes to your immune system, says what the virus looks like, and has instructions on how to kill it. And then, like a Snapchat message, it just disappears.
David, that is such an interesting way to think about that. Thank you. For more now, let's bring in Dr. Nissola. He's a medical expert, immunotherapy scientist, and an advisor for COVID Act Now, a nonprofit that provides data on the pandemic in the United States. Dr. Nissola, thank you for joining us. You just heard our report about hospitals being completely overrun. As David just told me, they are out of beds there in Fresno, and the LA Times reported today that some ambulance patients had to wait up to 6 hours to be admitted into the ER. How long can the U.S. healthcare system survive this pandemic surge? And what is the impact not only on COVID patients, but other people who need medical attention?
Thank you for having me. Well, now we must immunize for impact. You saw it, and we're experiencing it every day. The healthcare system is at a breaking point. Some counties in California have already run out of ICU beds. Especially around LA area and San Bernardino. California also had to purchase more body bags because of the number of deaths. So it will take us some time until we're able to see the benefits from this first round of vaccinations. Heading into the holiday season, the new vaccines give us some hope, but we will only win the war against this virus after a large number of the population gets immunized. And that is far from becoming a reality now.
Yeah, and as we know, the first vaccine doses, even as they're being distributed this week to priority groups, are not going to be made available to the general population until this spring or possibly even this summer. Remind us, how much of an impact can these early doses have in containing the pandemic when so many Americans haven't received it yet?
Well, we saw some positive and exciting news from the data that Moderna published. Noting that perhaps the first dose can give Americans some immunity that could help us in this first batch and in this first round of delivery for those vaccines. Apparently, some immune response can be observed 14 days after the first shot. So I'm excited to see how this data will hold up as we collect more real-world data. And additionally, some nasal swabs that were collected after the first dose indicate a reduction of those asymptomatic infections. So recognizing the impact on this, on halting transmission of this disease is important. But the judge is still out, and we're learning as new data comes in.
And Dr. Nissola, just to make sure I'm crystal clear on that, you're discussing the results of the Moderna vaccine as opposed to the Pfizer one right now?
That's correct. Yeah, just the data that we first learned this week that will likely be reviewed by the FDA in the next week or so, that perhaps will lead to emergency use authorization for that vaccine, which will help us to deliver more doses of these vaccines to more people.
And I wanted to know, how significant is this development? Because, as you say, the FDA advisory panel is expected to vote on Thursday, and we expect that they are, in fact, going to recommend emergency use for Moderna's vaccine. Does this double the amount of vaccinations that are going to be immediately possible then?
Well, the numbers themselves, I don't know. But what I do know is that more vaccines will be made available for more people. And what that means, that will help us reduce asymptomatic infection. From early data analysis of Pfizer's trial, that seems to be about 67%. What we don't know is what happens after the second dose. But as I've been saying, let's hope that these vaccines will help reduce the spread of asymptomatic disease that requires medical treatment.
Well, we are certainly hopeful that that will be the case. As you know, there are some people, though, that have expressed concern, a sizable percentage of the American population, and we did learn that a healthcare worker in Alaska suffered serious allergic reaction after receiving the Pfizer vaccine. How concerned should we be about adverse reactions, and is this something to be expected when any new drug is released into the population?
Well, any drug, any medication, any vaccine will have and will carry those risks for side effects and adverse events. This vaccine for Pfizer has been tested in over 37,000 volunteers in clinical studies. Now, with real-world data, we're going to be learning more about how this vaccine behaves while given to the broader population. And most commonly, we have seen the reports from pain in the site of injection, some fatigue, some headache, and some muscle pain. Of course, allergic reactions to drugs are possible, and in some cases are common, but the FDA has issued monitoring guidance for those. So I think we should wait and see. And in case patients at home and people that are receiving these first vaccines have severe reactions, they should not take it right now.
Right, and remind us, the category of people who should not receive the vaccine are people who have previously had severe reactions to other vaccinations, but everybody else in the population, within the groups that are being allowed to get the vaccine right now, are in fact recommended to do so. Is that right?
That's correct. If you have an allergic reaction to any component of the Pfizer's vaccine, you should avoid taking it. You should not take it. If you have allergic reactions or known allergic reactions to medications, you should talk to your primary care physician in order for you both to understand if you can take it or not. Currently, the guidance is if you are allergic, do not take it.
And Dr. Fauci told CBS this morning, quote, "We should celebrate the fact that the science has come through, but it is not over yet. We have a ways to go." Why is it so important for people to keep their guards up at this point? How crucial are public health measures even as the vaccine is rolling out?
Dr. Fauci is right one more time. We will need to continue to practice what we've learned for stopping the spread of this virus through the year, which is wearing a mask, be physically distanced when you're meeting people outside, avoiding indoors at all costs, avoiding indoor dining, and making sure that the people that you are in contact with are people from your household. And also, if you're feeling ill, get tested. If you are planning on traveling, cancel your travel plans. I think it's an important message to talk to people that you love and give them a call, and making sure people understand that we can stop the spread of the virus. We can flatten the curve once more, but we need to do those things collectively.
All right. Dr. Leo Nissola, thank you.
Thank you for having me.